Now here at 4:30, an effort to improve menopause care in Illinois. 80% of women have symptoms that impact their overall health, well-being, and performance at work.
And that's exactly why there's a new bill that's working through the Illinois General Assembly right now, all to address an often overlooked area of women's health. NBC5's Kate Chappell joins us now to take a closer look. Kate?
Stephen Marion, it's called the Menopause Equity and Care Act. It passed the House and it's now in a Senate committee. It'll affect how women are treated at work, insurance coverage, and also getting out more education about menopause. So today I sat down with the sponsor, State Representative Yolanda Morris from Chicago.
I said, I'm having a hot flash right now.
For State Representative Yolanda Morris, a bill she sponsored is personal.
I just broke out in a hot sweat, like a temperature turned up in my body like never before, like you couldn't cut it off.
She had a hot flash in committee as she was introducing House Bill 5284, the Illinois Menopause Equity and Care Act. Like so many women experiencing one of the major symptoms of perimenopause at work.
I just want people to know that this bill is about dignity. This bill is about health and fairness.
More than 1 million women enter menopause every year. The purpose of this bill is to improve awareness, understanding, and quality of care for women in Illinois. If signed into law, it would require the Department of Public Health to make educational materials about symptoms and evidence-based treatment options available to the public, and voluntary educational resources available to support clinicians. Right now, fewer than 20% of primary care doctors receive any formal training in menopause. That's according to the nonprofit organization, the Menopause Society. Illinois already mandates insurance coverage for FDA-approved menopause treatment. This bill would amend the insurance code to expand coverage, to include a wider range of care like diagnosis, more treatment options, and osteoporosis medication.
We have a lot of branded products like estrogen patches and gels and oral medications, but when we need to step outside of some of the generic products, or, we have women who have breast tenderness or they can't tolerate a certain class of medications, we're having to reach for compounded options or branded options that are, oftentimes not accessible.
Dr. Christy DeSapri founded a clinic in North Suburban Chicago that focuses on women's midlife health. She says this bill will help address access issues many of her patients face daily.
There's some, supply chain issues with estrogen patches and other products as the demand, has increased. So I've seen some of the prices rising also for some of these products that used to be a little bit more affordable.
Also really important here, the bill would require most employers to offer reasonable accommodations like modified work hours, temperature control, cooling spaces, or the ability to work remote if it's feasible. And if this bill is signed into law, it would take effect January 1st, 2028.
Okay, some important considerations there. Kate Chappell, thank you so much.
Kate.